Hi, I'm Dr. Jonathan Claar, and I am a board-certified chiropractic neurologist. My practice is made up primarily of chronic patients, and I pride myself on being up to date with the latest breakthrough treatments. I consult with over 1,000 doctors across the country on www.lifechangingcare.com, and I work with the author of the book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. So what makes us different from every other doctor that you've seen? Well, we treat you metabolically and we treat you neurologically. You're on this website because you or someone you love is suffering from fibromyalgia. And I'm here to tell you that no stone is left unturned to determine the exact cause of your problem. I'll guarantee you that no one has told you what I'm about to tell you. And I'm going to address what makes my program unique and how we successfully treat fibromyalgia. First off, before we get into that, what's really going on, or what's actually happening? Why do I feel this chronic stuff going on? Well, as you know, it's a result of nerves not firing properly, or it's a nervous system issue. So if we break our nervous system down into two parts, such as our parasympathetic and our sympathetic. Parasympathetic is more of our feed and breed, or our relaxed part of our nervous system. It's how we digest food. Sympathetic is our fight or flight. It's our stress part of our nervous system. Well, unfortunately, there's an area in our brain that's not being inhibited, called our mesencephalon. It's the upper part of our brainstem. And the frontal lobe needs to inhibit that area. But due to some stressor, it's not working properly anymore, and the sympathetic part of our nervous system has now become dominant. And the sympathetics are only supposed to be short bursts of time, or short period of time. So as you can see, we shouldn't be in that stress part of our nervous system for a long period of time. But unfortunately in fibromyalgia, that's in fact what's going on. This is not normal. We shouldn't be in the fight or flight for an extended period of time. And when those sympathetics are chronically firing, it leads to us not being able to sleep. Or if we wake up 2 or 3 in the morning and we feel like we can't rest anymore, we have headaches, sensitivity to light, you get the idea. This also fires what's called the adrenal gland, which is our stress gland, which tells it to release cortisol. And excessive cortisol from stress of the sympathetics leads to release of something called catecholamines that stimulate what we call our type C nociceptors. So what that basically means is this excess cortisol makes our pain receptors more active. That's more or less what's going on with something like this. So how do we successfully treat and support these fibromyalgia conditions? Well, nutritionally we use specific metabolic testing and treatments. We look at sensitivity testing because this is very important. We need to determine if you have a sensitivity to gluten, which is found in wheat, rye, and barley, milk, eggs, yeast, and soy. And if you're sensitive to any of these food groups, it can be making your condition much worse, as it will increase inflammation in your brain and throughout your whole body. Some of the symptoms of these sensitivities is chronic pain, fatigue, frequent indigestion, bloating after meals, constipation, frequent loose bowel movements. But folks, the only way to know for sure if you're suffering this stuff is we have to run a test. We do complete blood panels, a complete metabolic panel, lipid panel, a CBC with autodifferential. We can assess your adrenal glands, liver, kidneys, red white blood cells, look at gut function with all these tests. All this can be affected with chronic health conditions. So by addressing any problems with your adrenal glands, your blood chemistry, your gut function, we can help you heal faster. And we also have to make sure your blood glucose levels are within normal range, because that's important for proper brain function. Now I know what you're thinking. All my blood tests are normal. Well, we look at things differently in our office. Lab ranges, which are used to measure blood ranges, are very broad. We use what we call functional ranges or health ranges. Once you start to creep outside of your functional ranges, you're going to start having symptoms. Yet you won't be diagnosed until you creep outside the lab ranges. Lab ranges vary from where you are. The lab ranges we have in Harrisonburg can be different than they are 30 minutes down the road. I've seen it. They also are different depending on which company draws your blood. So, we look again at functional ranges, very important. We need to look and see if there's any kind of Th1 or Th2 dominance. And what that is a part of your immune system. It's kind of the balance aspect of your immune system. The Th1 is your T cells and your macrophages. Th2 is your B cells that makes antibodies. If you're autoimmune, then you need to rebalance this system. We don't want that teeter-totter spinning out of balance. But what's causing the imbalance? Is it from a dysregulation issue, such as a blood sugar issue? If you're dysglycemic, you have potentially developing prediabetes. If you have adrenal stress, if you have an anemia, or is it from an active antigen, like a yeast issue, a parasite growth, or an active infection? We look at the adrenals as well. We talked about the adrenals and how they secrete cortisol. But we look at this with a test called an adrenal stress index test. It's a salivary test, much like DNA testing. So the adrenal glands, again, sit above the kidneys, and they're our stress organs. If the patient has been or is currently under stress, this test is a must. And it's also a must if the patient suffers from insomnia or diabetes. It's going to measure those cortisol levels. We can get into hormone panels as well and determine if the patient suffers from low testosterone males or low estrogen progesterone in females. There's all kinds of symptoms that can be associated with hormone issues, but you also got to make sure that you have the proper fatty acids and everything else in place to make the hormones. So we also look at things through what's called a 2105 or a stool analysis. That's how we test for those things that are going on in the gut. Like, is there a parasite that's leading to this chronic inflammatory response in the body? Is there a gut infection? Are the bacteria in your system not doing well because of overuse of antibiotics? So the brain has a connection to the rest of the body, and we know that. And we need to use specific neurological and functional treatments to improve your health. So we use specific brain-based therapy such as vibration therapy, which fires the back part of the brain called the cerebellum. And one of the functions of the cerebellum is it controls the core muscles of the spine. We might also use auditory, visual, smell therapy, anything we can find to increase the frequency of firing the brain. We offer what we call Class 4 laser, which is the strongest or highest powered laser on the market today. Laser therapy helps heal tissue, helps reduce chronic pain. We also utilize what we call non-surgical spinal decompression. This is a computerized device we use that creates a negative disc pressure to help basically take pain away from people that have chronic low back and neck pain from herniated discs and stenosis. Relax the muscle. We utilize the ATM2 device, which is a rehab device we use to help basically restore motion impairments. Many chronic mid and neck and low back sufferers notice immediate results with this. We utilize the interactive metronome, which is a computerized device we use to help retrain the brain. It uses visual, auditory, and motor stimulation to increase the frequency of firing the brain. Go to interactivemetronome.com for more information. So once we've run the necessary tests to determine your condition, then we can successfully treat you with proper neurological and all-natural nutritional protocols. So you got to ask yourself the following question. How has your fibromyalgia affected your relationship, your finances, your family, or other activities that you used to enjoy? What is this really costing you? How is this costing you in time? How is this affecting you money? How is this affecting you with happiness? Where do you picture yourself in the next 1 to 5 years if this problem is not taken care of? And what is this worth to you if we can improve this for you? So I'm Dr. Jonathan Claar, and I want to thank you for your time.